Hello, welcome to Workforce Wednesday. My name is Emily Petnato. I am the Workforce Development Specialist at the Chamber and your host of Workforce Wednesday. Joining me again today is Aveanna Healthcare. We're very happy to have them on here and using Workforce Wednesday to help find them the home healthcare talent that they need. So thank you again for joining me today. How are you?
I'm doing well. How are you today, Emily?
Good.
Good.
So if we could just dive right in, you talk a little bit about what Aveanna is and the type of healthcare you service.
Sure. Aveanna Healthcare, we are a home health care agency. We work with individuals in their homes, but we also work within the schools. We work within facilities, and we work within helping get kiddos home from the hospitals. So we work with the case managers as well.
And what are you hiring for today?
We hire for everything. So we hire for direct care workers, personal care assistants, home health aides, certified nurse assistants, licensed practical nurses, and registered nurses. Registered nurses, I know, a little difficult right now. Everyone's trying to hire for them, but we do have some cases right now that we're trying to bring home from the hospital. So we are looking for high-tech registered nurses with trach and vent experience.
What are the base level experience positions you have available?
Well, base level, you can come in as a direct care worker, which is no training whatsoever. And you can work with the elderly. We have a lot of those positions available as well. They help with daily living activities like housekeeping, meal prep, toileting, transferring in and out of the showers, a little bit of laundry, medication reminders, things like that, going in their homes. But we also can contract with senior facilities. And our direct care workers and personal care assistants will go into those senior facilities with our contracted companies, and they'll help on that end as well. We also have direct support professionals, which would kind of be the next step above that. It's a nice job to get into. It's a one-on-one, but also we can contract with that as well and go into a more residential facility, residential group home. And that requires about 12 hours of training to start, and to finish off within a year, 24 hours of training. And you would work with our clients that have intellectual developmental delay disabilities.
So are they set hours, or do you get to pick your hours if you're an employee?
Well, the best thing about home health and Aveanna, you can pick what cases, and a lot of the contracts too have split shifts, first, second, third shift, things like that. But with one-on-one and in the home, you can pretty much pick your hours. We are very flexible with scheduling. One of the best things about home health versus hospitals is that there's no mandated overtime, no mandated holidays. If you want to work a school case, Monday through Friday, 8 to 3, that's what you work, and you have off in the summers if you want. If not, we can always find, the extended school year hours for you there, or a summer camp. We do a lot of work with summer camps as well. So
there's that flexibility there to pick when and where.
Absolutely. And a lot of the direct support professionals, a lot of those hours are, some of them are just, say, 4 hours a week or 10 hours a week. And you can do that. You can work 40 hours a week, or you can work 40 hours a month. We can piece together a couple of different direct support case jobs a week, or we can just give you a few a month. So it depends on what your schedule is. You tell us how many hours a week, how many days a week, how far you want to drive from home. We have so many cases right now, you could pretty much hand pick what you want to do. That's the good thing about home health. Yeah.
Can you touch upon some of your benefits that you offer?
Benefits are all dependent upon how many hours you want to work.
Okay.
So they're not as robust as the hospitals, I will say that, because their bonuses are so high right now. So I can't comment on that, but we do offer sign-on bonuses. We do have some contracts have our mileage reimbursement, which is nice. You can get health, eye, dental, you can get short-term disability, long-term disability. It's a nice little package. But however you want to pay into it, gold, silver, platinum, which is available 30 days after you start. And then, yeah, so depends on how many hours you want to work.
Is there anything that you'd like to mention about working at Aveanna or the positions that I may not have asked?
One of the things that I like about Aveanna, and I'll put this out for almost anybody out there, is that the contracts that we offer, there's a lot of facilities and a lot of residential facilities and senior assisted facilities out there. The contracts that we can offer are simple. I know a lot of places out there are busy and they like to go with what is in place already. Sometimes it's easier to do that than to start something brand new. But we keep it simple. We keep it prioritized for them. And I like to just let them know we are there for them. Rates are put in place for what their budget is, not necessarily just for us. They're there for them. And with our staffing, they don't have to go through all the training to train them and then find that 2 weeks later, the person that they hired walked out the door on them. Our staff is our staff. They just tell us what they need staffed and we send them. So they don't have to worry about a rotating door, onboarding and then find out that they left, and then they have to re-onboard someone or pay the bonuses. And then, we take care of the bonuses on our end. We take care of the benefits on our end. We take care of workman's comp on our end. All they tell us is what they need staffed and we send the staff. So we keep it as simple as possible and prioritized for them and as aligned in what they need covered for them. So that's nice.
Yeah, you're making it flexible for your employees and to work with others. So
yeah, and as flexible for the facilities as possible.
Well, thank you so much for explaining all the positions in Aveanna's work. Anything else you'd like to mention before we wrap up?
Merry Christmas to everyone.
Yes, happy holidays, and thank you for taking the time to join me today.
Absolutely.
If you are watching this right now and you're interested in registering for an upcoming Workforce Wednesday session, please contact me at epetnato@scrantonchamber.com. If you are a job seeker looking for positions available at our member businesses, we have our job board on the Chamber's website at scrantonchamber.com. And yes, happy holidays. Have a great evening. Thank you.